I'm Sujeet Rajan, respiratory physician at Bombay Hospital and Bhatia Hospital in Mumbai, with a special interest in sleep disordered breathing, airway diseases, and lung fibrosis. Sleep, restful sleep, Shahid, is very, very important for a human being to function effectively during his day. And a period of at least 7.5 hours of what I would define as restful sleep, good quality sleep, is critical in maintaining body homeostasis and ensuring daytime functionality is at its best possible. There is a lot of denial in accepting that a patient has a sleep disorder. And in terms of snoring, for instance, there is a huge issue with respect to denying that the patient has any problem. Many years ago, it was thought that snoring is a sign of very good and healthy deep sleep, whereas now it's more and more being realized that snoring can be harmful after we've seen with the pulse oximeter how oxygen saturations drop during snoring, and especially loud habitual snoring. Patients are worried about the gadgetry attached to them for a sleep study. They're worried about being labeled as having a chronic problem. And in general, patients are scared of machinery around them at night. And therefore, with all this denial that patients have, they'll end up not seeking help for the problem. By not seeking help, they don't get diagnosed and they don't get treated. And there are really dire consequences to that for the population at large. So sleep cannot be diagnosed with a blood test. That's something everyone needs to understand. Sleep apnea, I'm specifically referring to sleep apnea. There is no blood test to diagnose it. You need a sleep study. Now, there are different types of sleep studies, and attended level 1 or 2 studies can be done in India now, but they're a bit complicated in that you need a trained technologist and you need someone who can score that sleep report. So if the patient has access to such laboratories, you can get diagnosed. But with an approximate incidence of about 4 to 5% in the general population above the age of 40, you're never going to get our population to level 1 and level 2 studies all through the year. So you need much more portable studies that can be done at home, where the patient likes to sleep and is much more comfortable in his usual environment. If he enjoys alcohol at night, he can consume that, and it's his usual sleep area. So that's called a type 3 study, and portable monitors are available now in India. And if they are used increasingly, which is happening now, I think we'll get much more of moderate to severe sleep apnea diagnosed sooner, and these patients can at least then reach the doctor with a report. Some of them don't even reach the doctor, but at least they should, that awareness needs to increase so that the doctor can then institute treatment at the earliest. So awareness of sleep disorders, according to me, has been not a big priority for our government, and I can understand why. There are a lot of communicable diseases in India: malaria, dengue, and tuberculosis. Malnutrition are priorities for our government. But our government would also do, I'm sure, good to look at the rise in non-communicable diseases, which is diabetes, hypertension, chronic kidney disease, cardiovascular disease, and sleep disordered breathing, which is a huge area of morbidity, sickness, and days lost at work that people in India and around the world are suffering from. So the government can certainly do well by initiating some awareness programs, either through the social media or through television and media such as these, to increase awareness of the problem. Because it's usually the sleeping partner that reports to us. So it may not be the patient, but the sleeping partner that can understand this patient is a loud habitual snorer, sleeping off while watching television, sleeping off while being driven in a car on a highway, or getting often forgetful, that brings the patient and the sleeping partner to our clinics. Guidelines are there, but guidelines have to be practical and have to be followed. Guidelines serve for basically physicians and specialists to have a basic framework to diagnose and treat sleep apnea. Guidelines need to be disseminated and need to be easy to understand. The more complicated you make them, the less likely they're going to be understood. So guidelines are very important. If you look at the Australian system of functioning, no public transport driver can get a license to drive without a negative sleep study. That itself is a strong enforcement. We see so many road traffic accidents happening on highways because the driver has fallen asleep. So I think guidelines are very important for physicians to follow, and a sleep history, which we often forget to take, which a primary physician often forgets to take. We're not being trained in medical college to take a history of snoring, forgetfulness, and excess daytime sleepiness. I think that one implementation in a clinical practice of a physician can increase the diagnosis manyfold. So for all specialists, the message is that specialists and hospitals are mushrooming across India. And we are seeing more and more good specialized care. But in respiratory medicine and neurology, there is only that much that a general pulmonologist and general neurologist can do. So I think sleep and non-invasive ventilation is a huge branch, a massive branch actually, where young respiratory physicians and neurologists can subspecialize in. Hospitals will need that specialty because the volume of these patients is so high nowadays. They require more time, they require education, and a lot of these things can be implemented today in that hospitals will gain by having that subspecialty functioning in their hospital and that service available, that patients will be attracted to it. And the costs of machines and treatments are also coming down.